Thank you.
Okay, last but not least, Mr. Tony Landry with Veterans Action Council.
Good morning, Chair. Good morning, Committee. My name's Tony Landry. I'm a 6-year veteran of the United States Navy. Left with some back service-connected injuries to my back and left me with a lifelong chronic pain and emotional trauma and from the pain. So I'm here today to speak to that, and I always set an intention in the morning when I come to the committees. I bring my tri-folded flag. And my intention this morning is to honor the veterans who have committed suicide or overdosed in Louisiana and no longer with us, and also to work to move forward legislation for plant medicine, because I've had really good success with plant medicine, ayahuasca and psilocybin, to treat my alcoholism related to my chronic pain. And I feel that this committee, we're hearing a lot about the pharmaceutical model of health, mental health, but I haven't heard anyone speak to plant medicine. I implore the committee chair to put plant medicine on the agenda so that we can have facilitators and integration coaches to come in and educate people on how plant medicine is being used all over the country. Tons of studies on psilocybin use for these mental health conditions that we're suffering from in Louisiana. So I implore the committee chair to put it on the agenda so we can have a broader discussion on this. So, okay, so my testimony, basically I said a lot of it just now, you know, how PTSD and adverse childhood experiences, whenever we're born, all our synapses are communicating real good. Every time we have some kind of emotional trauma, those synapses kind of recall in, and it gets to a point where we just closed in and go into a depressed state. And this psilocybin, it increases brain neuroplasticity. And what that does is it allows all these synapses to start connecting again, and you're able to actually enjoy life again after you had some plant medicine therapy. So we need to set up some psilocybin therapy clinics. That's going to take leaders with the foresight to put in some legislation in place for research, training facilitators, rules and regulations for testing, so that we can get, like this cannabis program we got going. The medicine's so expensive we can't even afford to access it. There's no regulation. They have to test a little small batch of the cannabis, and then they turn it loose, the whole 500 pounds of it, to go out to the dispensary. I just bought some cannabis. I can't even smoke it because it burns my throat so much. I've got some complaints filed with the Pharmacy Board and the Department of Health to take this cannabis in and test it and see what's going on with it. So you want to talk about mental health access? We've got a Department of Health that's regulating a cannabis system in Louisiana right now, and they're not even doing the job. They're collecting 7% of our patients, the only patients in Louisiana that's having to pay a tax on their medicine. We're charging cannabis patients for this regulation that's not even getting done. So that's mental health access. We have a PTSD clause in our law to allow patients with PTSD to access this cannabis. We can't even afford to access it. And it's not even being regulated right. Okay, in conclusion, the creation of psilocybin therapy centers holds enormous potential in addressing the mental health crisis. By offering a compassionate and innovative approach to treatment, we can empower individuals to find healing, personal growth, and renewed hope. It's time to embrace these alternative therapies and provide comprehensive support for those in need, offering them a brighter future and a path toward mental health being. I implore you, decriminalize the use of psychedelic plants for treating mental health. If we can legally brew beer at home and put it out into the church carnival, the bazaar, and let them distribute it, but we can't grow cannabis or grow mushrooms and use them for our mental health? There's something wrong with this picture. Create a framework for psychedelic therapy research, education, training facilitators, clinicians, rules for secret shoppers, and testing compliance with fines and penalties such as licensing forfeiture whenever we have a public safety violation. Decriminalize home grow for all medicinal plants so that the uninsured, underinsured, and marginalized population can afford immediate access and treatment for plant medicine. Create a public awareness campaign to address the societal stigma surrounding psychedelic substances to foster a more open mind, compassionate approach to mental health treatment.
Thank you, Mr. Landry. Thank you for your service, and the board is clear. Thank you. Okay, that concludes our business. I just want to let everyone know that our next meeting is going to be Thursday, November 9th. We are going to focus on children, young people, so that's